Modern healthcare can work miracles. It can contribute to increased prosperity and security.
Healthcare is taken for granted in rich countries, but not in the rest of the world, where healthcare remains expensive, remote, and of poor quality. Too many people suffer ill health or even die because they cannot get the treatment that should be readily available. Households are plunged into poverty and the whole community suffers. Everyone should have access to healthcare without financial worries. This is why the elders are launching a new initiative to campaign for universal health coverage.
These three groups put together are the majority of our populations, particularly in developing countries. It makes all the sense to prioritize those who have been left behind, those who are majorities of our people, to be the entry point to achieve universal health coverage.
Women and girls have the greatest need of healthcare, but the least access to it in poor countries. Often this is because they lack the economic resources or independence to pay for healthcare. Even very small user fees stop poor people from accessing life-saving health services.
And think of the situation it leads to in some cases, where women and their newborn babies are locked in hospitals because they couldn't afford the fee. That is not acceptable.
Universal healthcare is therefore a way of delivering social justice, empowering women and ending dependence on patriarchal structures. This is why the elders believe universal healthcare must be publicly funded and free at the point of use.
Universal access to health services would go a long way toward fixing the huge social and economic injustice that still prevails in the world.
Even in wealthy countries, many are still excluded from its benefits and the comfort it brings to people who are sick and their families. I worked to improve access to health care when I was President of the United States, but it is still a contentious political issue today. Obamacare is a vital step forward, but too many people still lack access to health care in the U.S. today. Universal health care is important as a way of tackling entrenched privilege, reducing social barriers, and building solidarity. The elders believe that universal health care is an achievable goal if politicians have the courage to confront vested interests and oblige the rich to help pay for health services for the poor.
Access to health care has been a key part of the international development agenda for many years.
Universal health coverage has been identified as a key priority within the Sustainable Development Goals.
To be well educated, children need not only schools and good teachers, they also need to be healthy.
This is why universal health care is a crucial way to secure the legacy of the Millennium Development Goals and why the elders are fighting for it.
At many forums, not least the United Nations, governments have committed to universal health care. Now they need to honor that commitment with sufficient resources and good policies.
Health is a human right from the Universal Declaration of Human Rights, and it includes rights to food and water and sanitation. And it's so important that we see it as a right, because then people are empowered.
Access to good health services without risking financial catastrophe is a necessary condition to enjoy other essential human freedoms.
If people are denied because they can't afford to pay, I think that is a terrible denial both of rights and dignity. The elders embrace the idea of universal health coverage because it is based on rights and equity. It's for all, and it has to be government policy. It works in countries like Sri Lanka, Rwanda, Ethiopia, many countries around the world where there is the political will.
Healthcare is absolutely essential. As Secretary General, I used to go to villages and visit hospitals, and sometimes you have a woman lying in bed looking you straight in the eye without saying a word but asking a very powerful question. I have a condition which I know in other parts of the world could be treated. But because I'm here and I'm poor, this condition may be a death sentence. What are you going to do to help me?